All right, we're going to get started. Just a reminder to everybody, I'm recording this and it will be placed on our website for reference in the future. So welcome to everyone here, and I'll let people in as we go along if they come on board. I'll talk a little bit, then I'll ask if there's any questions and people can unmute themselves. So right now, good news on the state budget. It was very favorable for us. So it restored the almost $7 million in 1% across the board rate cuts that were put in place. It restored the cost of living adjustment, which we have not received one. We've received one in the last 11 years, and that was for 0.2%. So this COLA is 1% for all our Medicaid related programs. It also provides a 26.9 million, that was for the cost of living adjustment, 10.5 million, a 1% Medicaid reduction has been restored. There was also going to be a cut, a 5% withhold for all non-Medicaid state funded programs. That's also been taken off the plate. So that'll save us $12 million across the state. It also restores the Care Coordination Organization funding that was being taken away of 20.8 million. And the other thing that it does provide is there's $740 million in additional federal funding related to our field. That they really haven't come up with how that's going to be appropriated, but it'll be through a grant process or to enhance programs. So again, great news there. And additionally, President Biden, on his infrastructure proposal, has $400 billion across the country for home and community-based waiver services to enhance the services that are out there, as well as hopefully provide some support for staffing. So more to come on that. We don't have a lot of information regarding that infrastructure proposal, but all that's going to benefit us. New York State made out very well from the federal government on receiving support for COVID-related issues, which enhanced the state budget. So kudos to all the family members who advocated. We sent out lots of information because it was very effective. The ARC alone had a lot of responses at the family level and for people that we support to the legislature, and they're well aware of the issues. We reached out to them multiple times during negotiations because we had heard certain things were being put back in the budget, but thankfully they responded appropriately, and everything we asked for, we received. The only thing that's still on the plate that wasn't in the budget proposals is the residential cuts that are supposed to take place May 1st. However, we hear that those might be pushed forward a little bit. It may not take place for a while. We're hopeful that'll take place, but for right now, they're still in the proposal to take place on 5/1 of 2021. So anybody have any questions related to the budget? Okay. So on the COVID front, we're doing very well there also. We've had minimal numbers of people that have been positive and staff for a while. Year to date, as of last Thursday, we had 38 people that we supported that have been positive in both counties and have recovered. And we've had 101 staff in both counties, both St. Lawrence and Jefferson, who have been positive and have recovered. We are continuing to utilize the KN95 masks in the sites, and we'll be doing so for a while. As things start to get a little better, we will then go to the surgical masks or 3-ply masks, and eventually go back to the cloth if we can. But we continue to be very cautious. We've done very well as an organization the last several months or weeks. We did have an increase there for a while. It started in November, but it's now going down tremendously. We've had very few sites that have been put in quarantine or isolation. And I don't think there's any at all this week or last week. So we've done very well. 93% of our people in our residences have had one shot, and 89% have had two. So we're doing very well there also. In regards to our staff, the data that we've been putting forth, we've been demonstrating about 36% of our staff have been vaccinated. We have a large number that have declined, but we have found out that we haven't been recording the people that are in our non-OPWD programs consistently. So what we think our numbers are closer to almost 50% of our staff being vaccinated once we add those numbers in, and I'll be doing that report tomorrow. And we put that up on the website as soon as we get it done. So we're doing better with our staff, and our people that we support in our residences are in the high 90s. So we had a small percentage that are not going to be done because either the families declined to get it done, or the person has, or their physician has recommended it based on a Lyme medical condition. So high numbers there. The better we are, the better the community is, the more opportunities we're going to get back to normal.
I have a question.
Yep.
About is some of the things that they're including in the budget, does that include money for the staff salary at all? Does that?
Yep. The 1% COLA will enhance staff salaries, but we think on the federal level, there may be more money available later on for that also. So yes, that 1% COLA is the first time it's been done in a while. And I'll talk about it later, but staffing continues to be an issue for us in both counties. It's more severe in Jefferson than it is in St. Lawrence, but both counties are struggling with staffing. It's not just DSPs, it's DSPs, resident managers, clinical staff, nursing, bus drivers in St. Lawrence. We're having a hard time with bus drivers for our public transit. So we're hoping that with this 1% COLA and looking at other revenue streams that we can start to look at doing something with some of the salary structures. You know, minimum wage has been good to us in one way, but it's hurt us in others. You know, back before minimum wage, when minimum wage was at $7.25, we were paying $8.60 an hour. So we were always ahead of it. Now minimum wage is our base rate. So it's you know, and these are not minimum wage jobs. All our people deserve much more than that. So we are reconvening our staffing group and going to be brainstorming. We are looking at some of the positions and where they fit based on what's being paid in the community, and try to do as much as we can do with what we can afford at this point in time. But
Thank you.
Strategically, the long-term goal is to continue to get those wages up.
Thank you.
Yep. So we have, based on this, our support staff, our behavioral specialists, our QIDPs, qualified intellectual developmental professionals, our QS staff, our compliance staff, they're all now starting to go out and visit the locations. They have to wear the KN95s, they have to have temperature checks, they have to schedule their appointments with the manager so that not too many people are in the locations at any given time. But we think it's important to get those staff back out again and start working with the people we support. I'm going to start going out. I've had all my vaccinations, and I'm going to start doing the same thing. Here soon, I've started to visit some of the programs, but that's going to be a regular thing with me. Again, and our management staff will be doing the same thing. So we're going to slowly look at reopening some of our locations. Up in St. Lawrence, we're looking at enhancing the day hubs again. Probably be opening, I believe we're looking at Messina. We're back in the state ops, increasing some of our people in Norwood that are from the state operated facilities. Potsdam is not looking for right now, but we are looking at enhancing Canton a little bit with some movement of people to the Messina location. So we are on track to slowly reopen. There has been some new guidance that just came out. So some of the changes are, we no longer have to have a supervisor does the temperature checks, make sure people answer the questions appropriately when they're coming to visit. The bus is still a 50% capacity in the bus, but as long as the people who are being transported have been vaccinated, we can now put people on the same bus from different locations as long as they've been vaccinated. but the capacity is still, at 50%. So that is a little bit of a hindrance. So again, slowly looking at reopening, but being very cautious in doing so because our numbers still in the community are a little high. They're coming down, but they're still a little high. So we want to be cautious. We are allowing people to go out a little bit more into the community as long as they wear their masks. Right now, I think OPW's guidance is one community outing a day at the max. So we are doing those things. And again, we will react to what DOH, both locally in the state and the CDC recommend as we look at reopening. In Jefferson County, it's a little different because our main facility is under reconstruction. It's will be completed in the middle of early July. We'll probably be back in that building at the end of July for a day hab. So most of our day hab in Jefferson is coming out of the houses. And we have a small contingent that are from the community. We have no state operated facilities in Jefferson, and we are working on getting a satellite site for those community-based people until we reopen the Gaffney Drive facility. Speaking of the Gaffney Drive facility, it's coming along very well. I was over there today. If you drive by the site, you'll start to see improvements on the outside. It's really coming together. It's going to be a beautiful building. I went through it today. We have, I think there's 3 or 4 bathrooms that have the lifts built right into a track system in the ceiling. So we don't have to push those big Arjo lifts around for people that can't transfer from wheelchair to the bathroom or a changing table. Our PT area has an area that has a rail system all the way down the length of the room so that people who have ambulation issues can be strapped in and can walk with assistance. And then we have rail systems that 1 goes to a swing and 2 go to therapy rooms for transfers. So it's state of the art. The building's absolutely gorgeous, and it'll last for another 50 years, hopefully, because we spent about $10.5 million putting that together. Very successful with our capital campaign here in Jefferson. Michelle Carpenter has pretty much helped generate about $3 million. I think we're only about $150,000 shy of that $3 million goal. The rest of it, we have been able to use operating funds as well as reserves to cover those costs. And we did get a $250,000 legislative grant, which that's in that $3 million. So we've done very well with our ask from the community, especially during this COVID pandemic was a large portion of that. We are still selling bricks for anyone that's interested. We do have a sensory garden that's out front. And we have enhanced, we sold 300 bricks, and now we're looking at anyone else who wants to do that over a period of years. But a gorgeous garden in the front of the building, which people can go out and enjoy. Up north, we are looking at, nothing on the capital end at this point in time. Other than at some point, we've mentioned we want to really bring that pool at 6 Commerce Lane up to, it needs about $500,000 of work. That's a great resource for not only the people we support, but when we do that, we would open it up to the public also. We are looking at a bus garage up there for public transit. And we're looking at a grant with the Northern Regional Border Commission for that. That's down the road a couple of years. And it would be looked at as a business opportunity also to service large buses that need DOT certification inspection. So look at it as a revenue generator at the same time to assist with the public transit. Public transit in St. Lawrence has helped us spread the costs of our transportation, and it's been a revenue generator for the agency. So the ARC of New York has been going through a strategic planning process for the last year. We're now in our, we now have the objectives that have been selected, and we're working on diversity, staffing, which is a statewide issue, our program development and other options that are out there, as well as our work centers and what product lines can be consolidated. We're looking at diversity, and we're looking at governance, the governance of the ARC. The ARC is a huge organization with 39 chapters, and looking at how that governance comes into play. It can be good in some ways, being that large, for the power we have for advocacy, but in other ways, for example, the PPP loans through the federal government, we were prohibited initially from applying for those. And then we just received permission to apply. We didn't apply as an agency because we didn't feel we needed to or wouldn't meet the requirements, but it limited the ARC family, all 39 chapters, to $20 million. And the ask of the chapters that were looking to get into that was 107 million. So they had to split up that 20 million in a way that was equitable. But so in most ways, it's good for us to be that large. In other ways, it can hurt us. As I've mentioned before, we were successful in getting an HHS grant for it was close to $1 million. That's the only grant that we've gotten so far. FEMA is something I'm working on, and I'm just about done with it. It's about $123,000. That's ready to be submitted. It's a huge amount of work and paperwork that had to be uploaded into that site. But we're almost at that point in time to do our final submission on that. We just recently applied for a grant through Congresswoman Stefanik's office for 2022. We applied for $250,000 to assist with the equipment and supplies in the preschool here in Jefferson County. The other issue that's out there is the 14C I've talked about for the work centers. That's the Department of Labor certificate for our ability to pay sub-minimum wage based on productivity. There is a bill in the House right now for that to be repealed over a 5-year period. And there's also legislation in New York State that hasn't been introduced yet to do the same thing. So I've mentioned before, I have a 14C work group that's from the Executive Director Association of the ARC. And we have just broken up into subcommittees. Advocacy is going to be one of those. So we will be reaching out to family members and the people that we support that's important to advocate at the federal and state level for that to, number one, be possibly extended over a longer period of time, or that the money is allocated appropriately as we try to come up with more innovative programs that will allow some of those people to continue to work in that environment. So more to come on that, but St. Lawrence, we do a lot of what some of the other ARCs are doing right now is because they're going more to remote programming out of the residents. They're seeing that they don't have the need for transportation as much. So they're getting rid of some of their vehicles. So we just took over what they call a 5310 bus, which is a grant from the federal government. They pay 80%, we pay 20% of the cost. Steuben County ARC gave us their 5310 grant vehicle. It's a brand new bus. And then we're purchasing two 2019 buses from Otsego County. The buses are $124,000 each, and we got them for $35,000 for both of them. So a great deal there. And those are for St. Lawrence at this point in time. St. Lawrence's transportation will probably continue to be as large as it has been because of the public transit and the need to transport people because they're so rural. Where in Jefferson County, we're probably not going to need as many buses as we've had in the past. And our goal here in Jefferson County is to, within the next 2 or 3 years, become public transit providers also here, which Jefferson County hasn't been as forthcoming in that regard as in the past. I see Tara's on, so I'm going to let Tara or Lynn talk about the letter of intent we just put in for the, I think we talked about it last time a little bit, but letter of intent for Jefferson County to do some residential reconfiguration. So either Lynn or Tara.
All right, I guess I'll do it. So yeah, we just submitted a letter of intent to OPWDD to stay our intention of that reconfiguration that Howie just mentioned. We are going to potentially we're just going to move. We have 2 apartments at our Palmer Street location in the city of Watertown, and we are going to move those folks potentially to a 4-bed apartment. The apartments are currently being renovated, so everything will be, brand new in them. Really, the Palmer Street apartments don't really meet our standards anymore. It allow for single bedrooms for all 4 people, and it's a ground level apartment, so we won't have to worry about any type of, ambulation concerns. And we've gotten lucky so far that we have a potential second apartment right across the hall. So, if staffing is ever an issue, we'll have 2 sites that are right next door to one another to be able to assist. And there'll be 4 other single bedrooms in that apartment as well that's being renovated. And they've offered to put in a walk-in shower there for us. So we won't have to maintain any of the physical plant components to those apartments. It'll all be taken care of. They're well below, market value according to OPWDD. And we'll also be taking 2 other beds from another small house that we have that consistently loses money. In combination, those 3 sites lose approximately $380,000 a year. So, and they're struggling at a 75% vacancy rate at one of them for staffing. So it really will benefit the agency. It'll benefit the people we support. It'll provide more opportunity for some of those beds that we have a hard time filling. So it's definitely going to be a benefit moving forward in the future. So we're very excited about it.
And Tara, we're also downsizing too, correct? So we're taking 2 of those vacancies.
Yep. So we have 2 10-bed sites. And we're going to reduce each of those by 1 bed, and that will provide a single room for each of those people that are currently in there, and we'll be able to provide those two beds that we're going to move another single room. So that's one of the things that referrals look for most is the single occupancy for privacy. So we'll be able to offer that.
Any questions on that from anybody? Okay. So I'll open it up.
Howie, I have a question on something you said a little bit ago. I'm wondering, you're talking about opening up. I'm wondering in a house where none of the clients can tolerate masks, so they're pretty much out of luck as far as outings, right? Until.
Well, they can do an outing. They just can't go to a public location with, but they can go to the park or they can go, other places.
Right.
Yeah.
Got to be outside where maybe there's. Yeah. So I just hope that maybe, the home, that's the situation and the home my son is in. So I'm just hoping that all the staff is aware, with the good weather coming, because last year I did have some issues of, staff saying, oh no, we can't do that. We can't get outside. We can't get out of the van, and so I did have some issues. So
the last year was a little more restrictive. So things are opening up. Hopefully, I think it's going to be a while before publicly we can not wear masks.
Right.
But we doesn't preclude people from doing other outdoor activities where they're not exposed to us, people like in a Walmart or store. We can
right, exactly.
Yep.
Yeah, I don't want my son going to Walmart. That's for sure. Yeah.
And they can do drive-throughs for food and those kinds of things. So.
Right. But at least, I just hope they get to take them outside and, find something for them to be. And I know some of the staff is like, oh, wait, we can't be cooped up again, Yeah,
the other alternative for St. Lawrence is Dodge Pond. We do have that beautiful facility we can go and utilize. We are not going to be doing summer camp with the kids this year because we still haven't gotten guidance from DOH on what to do with the camp. However, we can use it for ourselves. And we probably will be doing some of the mini vacations like we did in the past. So it's no, we can probably look at the houses utilizing that space periodically too, so.
Mhm. Oh, that'd be great. Okay, thank you.
I had a
Howie,
quick question.
Yep,
Howie,
yep, one second, I got Joyce on here first.
Howie, I lost.
One
Oh,
second,
okay,
one
okay.
second, Alan. Okay, go ahead, Joyce.
Do you have a time frame for the Dahab people who are still at home?
We're just waiting for OPWD to certify the location we're gonna be. We were over to the old church there on Route 11.
Yep.
They didn't meet their standards for fire protection. So now we're looking at the St. Anthony's classroom. We're just waiting for the city of Watertown to give us a letter of occupancy or a letter saying that they don't need one there. And I believe we have completed the fire testing. Alltech went and did that for them. That was the other requirement. So we're just waiting for the city to give us that letter, and then that site will open up. So hopefully soon.
Okay.
We're a little disappointed, OPW doesn't work quickly. Yeah, and it sometimes takes, we've had to submit the certificate of need, I think 3 times, because something was wrong. Either I wasn't dotted or T wasn't crossed, or we spelled something wrong. But that's all done now. We're just waiting for that one document, and hopefully soon.
Okay, thank you.
That's correct, right, Tara?
Yes, we've done the Alltech fire system check yesterday, and now we're waiting on the application to be approved. And then basically we'll be relying on finding staff that we can pull to staff that site.
Okay, Ellen?
Howie, I'm sorry, I lost my internet for a couple of minutes there. When you were talking about the people and going out and that, and when I'm up there, will I be able to take Patty Kay out for a ride, or can she only go in one of your vehicles
No, she
when
can
she
go with
goes
you.
out?
No, she can go with you.
Okay,
No
okay.
problem.
Thank you, Howie.
Yep. Any other questions?
Mr. Ganter, Kathy Worthen here, Gina Griffin's sister. Can you explain to me exactly how, when you reopen Dahab, how that's going to work? From what I've been told, it's not going to be like it was, which I understand because of the pandemic, but I'm concerned about the structure that she was getting, that she won't be getting anymore, and the interaction with her other peers. Because every day she's asking me when she's going to go back to see Lisa and her peers,
Yeah, I mean, I'll give you my $50,000 foot high summary, and then I'll let Tara explain if I don't do it correctly. But that building's being designed now. There will be, for the people in the community, there will be rooms for them that'll be coming in. And then there will also be a retirement room, but it's going to be very person-centered. So if someone wanted to come in every day, we're going to try to accommodate that. But we're looking to be more choice. And the rooms are going to be set up based on activities. So people can choose what activities are going on and come to that. It's not going to be so much like the old where you were just a classroom that did a variety of activities in there. The rooms are going to be activity based now. There is, like we talked about, all those rooms are exposed to natural light. We do have a large, kind of like a cafeteria, but it's not a cafeteria, a large room where people can congregate and have lunch, and there's a kitchen in it. But every room's going to have, a variety of the rooms are going to have activities that people can pick and choose if they want to go in the community that day or if they want to come to program. The building really, the way it's designed now, I think before we were up to 100, 110, 15 people, 125 people, I think. We're looking for daily census of about 75 to 80 at the max, but it's more person-centered, based on activities, not a set self-contained classroom like they were before.
but will she get the interaction with her other peers instead of those just at her home? Because that's what I'm worried about, that she's just going to get the interaction with the 2 girls that she lives with and not be able to visit with all her other peers that she's been with for over 30 years,
Tara?
you know.
So yeah, I'll pipe in now. We did just receive more guidance in in accordance to the restrictions that OPWDD put on day programming. And to answer your question short, yes, she would be able to attend day program and see other peers that don't live with her. Currently, they're still requiring that 6-foot social distancing, so we have to provide 36 square feet of space for each person. Lucky for us, the designers of the new space, they're all wide open classrooms. And as Howie spoke about, the cafeteria type space, I refer to it as like the common area. It's wide open. There's no doors closing it in. There's lounge areas with, TV sets, and there's the kitchen with a concession window, and to kind of incorporate different programming, we have started a program planning committee. So certain staff, DSPs, from both the residential and day hab program, managers, and some outside people. I know that some nursing personnel have asked to be on the committee, have started to plan different activities that are going to be going on.
Okay.
Ideally, we would love to see everybody at 100% there and be able to attend every single day. But I think what day hab looked like in the past, we do keep saying it's not going to look like that in the future. It's really just blowing out the walls. The sky is the limit. Whatever people want to do it. And although we understand that people thrive and are very successful in a structured environment, I think the pandemic has proven that they're resilient, that folks, can handle being home all the time, or they can handle different changes that have occurred in their life. And I think that the new model that you're going to see is really, the model that is being pushed across the United States, because the pandemic has pushed us that way. That programming is really going to be so person-centered that there are no limits. And our staff are very excited. I know our management team is extremely excited because we see this new building and this new space, not only encouraging day programming, but also for, maybe folks that don't live in our residential sites being able to come off hours and participate in different activities, or that go to different agencies. Maybe some folks that go to DPO Day Hab, how they open up their building to us for different activities. We see that happening. And, residential sites wanting to use it on the weekend. I really think that folks are really going to thrive in this new environment. So we're all very excited over it.
And it sounds nice. Like I said, she's a people person, and she's just dying to see all her peers and her friends. And, I don't know what to tell her. And
Yeah, I mean, like Tara said, it'll be person-centered. It'll be based on what she wants. So, I mean,
okay.
There'll always be people there every day. It may not be the same group of people that she's with, depending on the activity. So,
All right. Okay. All right. Thank you.
in St. Lawrence, things will stay the same as we evolve back in. But it's just different up there. The model we got, and we've got more sites, but not a huge change up there as we look down the road, maybe a little bit, but at this point in time, things will remain the same. And as long as those, like Tara said, as long as that guidance remains consistent, we do have to abide by. It was no more than 15 people in a room, and now that's been taken away. It's the 36 square feet divided by the room size will give you the number of people that can be in that area. Okay, any other questions?
Howie, going back to the budget now, it passed to put more money in for staff. Does that mean some of the existing staff will get raises, or how does that work?
Yes, the 1% COLA will provide us funding to be able to give a raise. We are, like I said, strategically looking at, trying to, historically the bottom's been going up, but we need to, $12.50 is the base rate. We know there's a lot of enhancements. I think I've talked about it. there's 25 cents more an hour if you are van certified, be able to drive people we support. If you go through the online training for direct support professional, there's another quarter an hour once they complete that. We do have a variety of locations that have an enhanced rate based on the needs of the people that we support in that environment. And then we have our med certification. Anybody who's med certified gets a sliding scale depending on how often they pass meds and the number of meds they pass. So there are a variety of ways to increase staff salaries, but $12.50 an hour is not, the direct support professionals, they're not a minimum wage job. They have way too much responsibility, and their jobs are very complex. And we will continue to advocate to raise the base, but also the people that have been here for years that deserve to get a raise too.
Yes, they do. I couldn't do their job, even though I worked in special ed for 28 years and I raised my son. My son lived with me for 32 years, but I don't know if I could go in. I see, what they do. I don't know if I could do it. And I have a lot of respect and a lot of thankfulness for them.
Yep, staff they've done a great job, but
They have.
really during this COVID, I mean, we're over a year now. Since that's gone into play, and they've done a tremendous job of abiding by, the restrictions we put in place, the masks, the checking people in and out, and then people being, basically cooped up for a long period of time before they did releases to do something. So it's been done a wonderful job.
My son's house, I don't think they had one case, staff or, people, staff or people, I don't think they had any COVID in that house. So I told them, you guys have done something right.
Yep.
That's for sure. So, all right. Thank you.
You're welcome.
Howie?
Yes.
Howie?
Yep.
I have one more question. Before the pandemic, when I would come up and Patty Kay would be across the street in her day hab, I used to be able to go in there and sit with her in there. Will I be able to do that if she goes back when will they be going back? They'll be going back before September, right?
They'll be going back in the day hab section.
Going across the street, will that be open?
In late July, but again, it'll be based on choice. There'll be some days if she doesn't want to go over there and she wants to stay in the house, she can stay in the house, or she wants to go out in the community. But yes, we have rooms available. We have rooms available for visits over there also. There's lots of.
Okay.
You won't recognize the building. You won't recognize it. It's been completely changed inside. Even me, when I'm in a certain section of the building now, I have to think about where I am at because it's just all new.
Oh my gosh, that's awesome. Thank you, Howie.
You're welcome. Any other questions? So we did talk about last time a little bit, reinvigorating a family group just for advocacy and to talk. So we will be sending out some information on that. We would like to get a group together to meet periodically and have you guys work on some issues with us. We always are going to have to advocate for certain things. Right now that the 14C issue is a big issue for us because, long term, if that does happen and there's no other alternatives, some of those people that currently work in the work center will not be able to work in that environment. We want to make sure there's something for them once that's repealed down the road. But we'll always be asking for support from family members. And I will just say that our legislators have been very good. They're all well aware of our issues. They often call and check on things. They ask for input, both up north and here. So they do a wonderful job of responding to us and to family members, have their support. Okay, any other questions? Okay.
Howie, the ladies from Ira 2 have a question, it looks like.
All right. Are they on mute? Are they muted?
You're on mute, ladies.
Is there a staff?
Yep, there's a.
Yeah. Now
There
we
you are.
There you go.
Oh, Howie Ganter, I got a question, buddy.
Okay.
Are we still gonna be our own guardians and spend our own money?
Are you talking about rep payee?
Yes.
Yep, so we're still your rep payee, yep.
Will we still be our own guardians, or have to have still staff with us?
Well, for you're not who's your guardian?
Nobody.
Okay, I don't think you need one.
No, I don't need one.
No.
Well, I've got a question now.
You can advocate for yourself.
Yes.
Go ahead, Molly.
Yes, Molly, go ahead.
How you like our garden
Presentation.
and
Presentation for people.
hey, that's neat. How you like the garden
Presentation.
in the Primo area? How
The
you
presenta-
like it?
Or present-
The presentation, there we go.
How do I like the what?
The presentation that we did for our garden project. for-
Oh, your garden project was great.
Community
That was
Freedom.
wonderful.
And I helped color the board for.
Yeah.
them.
So today, the people in Community Pre-Book did a presentation to Lynn and myself and Karen down at the work center and Nancy Otterkirk. They're actually putting in, they wanted funding to put in a large garden and did a great presentation on what they're going to do with that, how they're going to maintain it, and how they're going to share that food down there. So great job. Great job.
And told me help decorate the board.
I help them decorate the board too.
Yep, very
Nice.
good.
And I went out and helped get the supplies for the tables.
Yes, we all got little gifts too. I think that was a bribe, but it worked.
I loved working with them.
Me too.
I got another question, Howie Ganter.
Okay, Kathleen.
Do we still see our friends and family too if we do go different places? Or still can see our family and friends?
You can go visit family. Yep,
Okay, thank you.
you're welcome.
Thank you.
Okay, guys, any other questions?
Yeah, I think you had a question, didn't you?
No,
Becky, you have a question?
No, just say thank you for.
So we're gonna have a self-advocate meeting probably the next week or the week after. I'll let you
Okay.
guys know.
Okay, okay.
And we should say thank them for coming out and seeing our presentation today. We want to thank you for coming out to see our
Yes.
garden project today.
Oh, not a problem. Thank you for inviting me.
I'm Howie Ganter.
Kathleen,
I got a question. How long you knew us? How long you knew us, our families and friends?
I've known you guys. I've known some of you ever since I've been here. So
How long had that been?
Kathleen, I think I've known you for about 25 years.
Whoa!
Ow.
Is that when you got the apartment by just in case?
Yep,
Are
you-
you-
yep, way
Number
back
four?
then. Yep.
Yeah.
I'm the
Okay.
new kid on the block.
I feel it.
Ask the tell how long you knew you, Molly.
I've known Molly probably about the same.
Oh,
How you knew Becky? How long you knew Becky?
Probably about 20.
20.
Oh, wow.
How long you
Okay,
knew?
guys, we're gonna end the meeting now, okay?
How long you knew Erica? She knew.
Right here.
I'll see you later. We're gonna end the meeting now, okay?
All right,
Okay.
thank you. Bye.
Bye.
Bye, everybody.
Ready?